Well, today we're back at Gulf Coast Knee Pain and Neuropathy on Pass Road in Biloxi. Talking to Miss Tina. How are you?
I'm fine.
Well, good, good. What brought you here to see Dr. Mitchell?
I saw a very big advertisement in the Sun Herald, and that's how I came here and started.
Okay. So, what kind of problems were you having?
Knee problems.
Knee problems?
Yeah.
Yeah. They lock up on you, or just you having problems
No,
walking?
just hurting.
Hurting.
Hurting pretty badly.
Yeah. To the point where it was hard for you to walk.
Yes.
Okay. Okay.
I did, but it wasn't easy.
No. Okay. Well, I understand you used to be a runway model a few years back, but you had.
Well, that's quite a number of years back. And that was, I've done some modeling here in the United States, but
Could have been walking in
that
those
was
high
all
heels.
in Europe.
Oh, really?
Yeah.
Okay. Spent
Yeah.
some time overseas. That's awesome. That's awesome. So, how long were you suffering with this condition before you came here?
About 3 years.
Really? Okay. It just got worse and worse and worse.
Hurt more and more and more.
What other treatments did you seek before you came here to see Dr. Mitchell?
I beg your pardon?
What other treatments did you look for before you came to see Dr.
Well, I
Mitchell?
went to an orthopedic, and they gave me some ointment for it and an injection a couple of times. And because they thought that this here with the knee, that there was cartilage there.
Yes.
But that didn't help at all.
I heard those injections hurt. They don't feel
No,
too
the,
good.
the injections didn't hurt,
Oh,
but
they didn't? But it didn't help
they
you.
didn't help at all.
Okay, that's
No,
the important
nothing.
thing. So, coming here to Dr. Mitchell, about how much do you think, percentage-wise, it improved things for you for your knee?
At least 80%.
80%.
Yeah.
So you're getting around a lot
Let's
better
say
now.
75, 80%.
Okay. All right. So you and you're 93 years
Don't
old.
say it so loud.
I'm sorry. Okay. She's 93 years old. But you look great. You're getting around great now.
Okay,
That's
fine. Well, I take my cane because I don't want to fall.
Well, I can understand that. I can understand that. Well, it's good to have you around so long, and it's good. I'm glad you came here to see Dr. Mitchell to help you out.
Well,
and we're going to talk to someone else now here.
Okay.
Thank you very much.
Thank you very much. Thank you.
Miss Eileen, how are you?
Fine, thank you, and you?
I'm very well, thank you. It's good to have you here, to talk about the relief that you got at Gulf Coast Knee Pain and Neuropathy. You had knee problems.
Yes.
What brought you here? I mean, how did you find out about them?
Oh, see, that was a good question because I was going to say what brought me here was my truck.
Uh-huh.
But
That's why, and I knew you were a little catty there, so I kind of, steered away from that because I figured that's what was going to happen. So,
but I saw the ad and I thought I needed something with my knee. And not only did they fix my knee, they helped my husband's neuropathy.
awesome.
And he found a girlfriend here, and that's what I told you. This is a good place to come because not only do you get treatment for whatever ails you, you get hugs and kisses and all kinds
It's
of
like
good
big
stuff.
family.
It is.
Yeah.
It's a nice place to
It really
come.
is. It really is. I mean, I've
So-
been here, and besides Dr. Mitchell, Angela, Devette, and all of they're really great people.
And that's what makes you feel better.
Yes, definitely.
Not only the treatment, it's the extra treatment that you get.
What were some of the things you had problems doing before you came
Walking.
here? Walking, period.
Yes. So a lot of pain in my knees. And
Yeah.
so,
Jitterbug was out, huh?
yes, well, it was hard just taking care of my husband. So,
Oh, okay. All right. But he's doing better now with the neuropathy treatments.
well, it helped him until he died.
Oh, I'm sorry. I'm
So,
sorry.
But
But yes, okay.
Yeah.
How long did you suffer from the knee problems?
oh, a long time. I
Yeah.
can't, when you're having fun, it's hard to keep up with time.
I like you. What other treatments did you did you
didn't.
try? No,
No,
nothing.
no.
You
They
came
told
straight
me
to Dr.
they-
Mitchell.
No, they told me I'd have to have surgery, and I
Oh,
didn't.
yeah.
I couldn't have time to have surgery.
No,
It just
takes too long to recover from
Yeah,
that.
and I didn't have. I was doing nursing care 24/7, so there
Really?
was no time to
Okay.
fool around.
What percentage would you say that you had?
Oh, I'd say about 60–70%.
Really?
Yeah.
That's big.
Yeah, it is. I could walk and do stuff, but I have to keep coming back.
Sure. We'll follow up from time to time.
Yeah, because I got to get my hugs.
Yeah. Maybe I need to twist my knee and hit the ground or something like that. Come
Well,
over
just
here.
pretend.
I can do that.
Yeah, and
You
just
know,
say,
it's all-
oh,
that's all about TV. You have to act. So
yeah, that's it. So just say, oh, gosh sakes, I'm having a lot. And then Angela and Yvette hug on you, and you'll just feel so. Don't tell your wife about it.
Okay,
though,
I won't.
Because, you know, then she won't let you come anymore.
Thank you so much for sharing some time with us here. We're going to talk to Dr. Mitchell now and find out more. You love this lady. Those ladies are characters.
Yes, they are.
I tell you
I
what.
should have warned you.
Yeah, thank you very much. Knee pains. I mean, they both came in for knee problems. I guess with age, those things are brought on. But you know, without having to deal with surgery, how do you deal with it?
Yeah, when patients come in with the knee type issues, a lot of times we're their last hope before surgery. And you listen to Miss Tina or Miss Eileen, is that they've been told that they have bone on bone, and surgery is really much your last option. They went through the gamut of shots, the pills, either rehab, the injections, and nothing seemed to work, or it worked temporarily, but the pain come back several months later.
Right.
So with bone on bone, there's a different program. It's a different program than let's say neuropathy. What we have experienced in our office is that usually it's a weakening of the quad muscles. The quad muscles are very weak as we get older. The muscle just gets atrophy. The lower back, the nerves that come off that lower back have to go down and feed those tissues.
Right.
And we have found out a lot of times with that knee problem is that you have a lower back condition that we have to address, and also to address the knee pain. So it kind of goes hand in hand. You don't do one without the other.
I was going to say, I mean, that just one leads to the other, and if you don't, you're going to really have some major complications after a period of time.
Yep, you will. And so the treatments are, again, we still use the cold laser on certain things. We can use it on the tissue in the knee. We can use it on the meniscus. So, you know, any of the viewers that are watching this, and we have a great success with knee pain and neuropathy, is that patients can come in, but we've got to find out what they have that we can treat. And you've been here before, and I always say that, is that we have to rule you in or rule you out for the care in this office. And how we do that, we only accept patients we know we can help.
Right.
So in other words, they can come in for $60. If we can help them, we'll help them. If we don't, I'll reimburse their $60 to them.
Wow.
So that's how we operate.
That's a heck of a deal.
Yeah, that's how we operate. We just got to find out if that condition is something we can treat.
Do they need a referral from their general practitioner?
No, they don't.
Okay.
No, they can just call the office, call Yvette, make an appointment. We only accept so many patients per month because of the treatments involved, and they don't need a referral. We are a provider for all insurance companies.
That's awesome.
Except Medicaid, and we don't just take disability.
All right.
So,
Dr. Mitchell, thank you so much.
You're welcome, Jim.
Appreciate
Thank you for
that.
coming in. Thank
if
you.
you have any other kind of problems like that, knee pain or neuropathy, give them a call.